Two, when I told you about TTP and HUS, I just remembered that positional in the first aid, left versus right. One is a female, one is kids. If I know one, the other one's the other one. That's like positioning and anchoring information. The third option is we use Anki and we slam things, basically hoping by looking at it 20 times, it's going to stick. The last option is memory, just memorizing. And honestly, I don't know about you, I can't memorize a lot. So this is my technique that I use. And if I try everything and I just can't do it, then I try to memorize it, repeat it a couple of times and go from there. You guys should all know this by now. If not, you should. We have inducers and inhibitors. I mean, look at all these medications, guys. This is tackling a lot of organ systems in USMLE. So a quick tip, what I usually do, and think about what you would do. If I asked you all, you have 10 minutes to know these, how would you know them? It's not easy. It's unrealistic. But what I would say is you need to know all of these because they can pop up anytime. So what I usually do is I look at the inducers and I say, well, there's a lot less here than here. All right. I know rifampin pretty well. We all do, right? RIPES, R-I-P-E-S, rifampin, deals something with the RNA, inhibits the RNA polymerase, right? Something with the RNA. It's red, orange, body fluid. It revs up to P450. So that hook of learning rifampin brings me here. Then in my mind, I remember griseofulvin because I just remembered rifampin, griseofulvin next to it. Under that, carbamazepine and chronic CNC, carba, and chronic alcohol use. You should know these. Don't memorize them overnight, but every time you come back to this list, you start adding more to your foundation. So what I would say is choose a short aside. Say, I'll learn a couple of these for now, and then move on with my day. Come back to this list and say, well, rifampin, griseofulvin, carbamazepine, and chronic alcohol use. Okay, let me go. What else we have here? Oh, we have modafinil, which is, it's used for shift work sleep disorder or narcolepsy, I think, for sleeping. Phenobarbital, phenytoin. And then you move on with your day, you come back again, and you repeat again the list. And after a couple of times, you're actively repeating the list, not just looking at it like this, hoping to stick, right? And then later you say, well, I know my inducers, rifampin, griseofulvin, carbamazepine, chronic alcohol use, and I go to the top, modafinil, and then you're like, okay, I got one side. Typically, if you know the side, and you get a question about CP450, you can probably knock out the wrong answers by knowing at least one of the lists here, right? This is what test takers do to conquer material in a short time frame. I cannot take 2 years of basic sciences and push it in a month. It's not possible. I can show you how to pass the test. Yes? Yes. And I'm sorry to say, First Aid's a great book, but I think a lot of us are intimidated because a lot of information. Like if you go like this, page by page by page by page, I don't know about you, but I start getting a panic attack, right? Oof, more information. And then I stop reading and I go do something else. So I'm trying to make it interesting and show you guys that you have to be efficient and effective. I know a lot of us here are preparing and studying and very disciplined, 8, 10, 12 hours, sacrificing family and friends. But I'm sorry to say, you're not there. You're not where you need to be. And there's a reason why.